Welcome everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. We are pleased to inform you that the portal to check results is now available. Please go to our website for the link. As you know, we now have 2 assessment centers. One is in Leamington at Erie Shores Healthcare, and the other is at Windsor Regional Hospital, Olette Campus. I will now share the most current case counts. There are 30,092 confirmed cases of COVID-19 in Canada and 8,961 cases in Ontario. Chatham-Kent has 25 cases and Sarnia-Lambton has reported 128 cases. Michigan now has 29,263 cases with 7,383 cases in Detroit. Today, we are reporting 12 additional confirmed cases of COVID-19 for a total of 439 cases in our community. 58 people have recovered. 19% are between the ages of 50 and 59, and 21% of our cases are 80 years or older. 38% are male, and 61% are female, and 1% are unknown at this time. We are sad to report 3 additional deaths due to COVID-19. Our community has lost a total of 21 people to COVID-19. 13 deaths have occurred in long-term care and retirement homes. Our health unit continues to work with 7 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. 38% of all cases are in long-term care facilities. The health unit continues to follow up directly with everyone who has tested positive and negative for COVID-19. As I said at the beginning, you can now check your results online. It's important to remember that you must remain in self-isolation while awaiting your test results. Over 3,282 individuals have been tested for COVID-19 in Windsor-Essex County, and of those tested, 568 tests are pending. Testing should be based on clinical assessment. Healthcare workers, caregivers, care providers, and first responders should all be tested as soon as possible if they develop symptoms. Testing guidelines also include testing symptomatic residents of long-term care and retirement homes. All residents will be required to remain in self-isolation for 14 days following an admission. This includes testing residents without symptoms who are new admissions or readmissions to these homes within the first 14 days of arrival. During a COVID outbreak in a long-term care, testing will be increased to include asymptomatic residents who are contacts of the ill resident. Hospitals are being asked to temporarily stop transferring hospital patients to long-term care and retirement homes. Certain groups are prioritized for testing in the event of shortages of testing supplies, including symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents and staff of long-term care and retirement homes, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated, rural, and Indigenous communities, symptomatic travelers identified at a point of entry to Canada, symptomatic first responders, firefighters, police, EMS, and individuals referred for testing by our health unit. Please continue to visit WECHU.org for the most current information and case counts. Symptoms of COVID-19 include fever, cough, or difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, and having headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone assessment or a virtual assessment. They will be able to guide you in next steps, including contacting public health or attending one of the assessment centers. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. Once again, I want to thank all our healthcare workers, essential workers, that are working more than ever to meet the needs of the community. While a significant number of people are not working at the moment, all these essential workers are doing more than before to keep the community safe and ensure that the basic needs of the community are met. So thank you. As we are battling the COVID-19 pandemic in the region, it is with great sadness that we lost 3 lives yesterday fighting COVID-19 in our region. A male and a female in their 80s and a female in her 90s has lost their life fighting the COVID-19. My thoughts and prayers are with the family, and I would request once again, please treat these deaths as people, our parents, our grandparents, and not just in the statistics. As we're seeing the impact of COVID-19 in our community, especially in our long-term care home, locally there has been a conversation on moving some of these residents from COVID-19 outbreak facilities to other facilities to reduce further spread of COVID-19 in each of these facilities. Ontario Health, acute care hospitals, and public health are in discussion to find the best way to approach the situation. Windsor Regional Hospital will be opening up their field hospital to accept patients from long-term care home retirement homes to provide care and reduce the burden on these homes and also contain the disease as much as possible by utilizing some of these beds that are available and can be used to house these people. You will hear more details as soon as all the details are finalized at all ends. If you have a loved one in these facilities and are being considered for transfer, the facility will approach you for the appropriate consent before these transfers happen. Thank you. I will now move to our epidemiological summary update. So very quickly, once again, this is what we will try to cover in our presentation. I'll focus on the key points to answer some of the questions that everyone, including myself, is asking, and the conclusion that we can draw from these data to help us apply evidence in making public health recommendations. The epidemic curve or epi curve help us assess the progression of this disease, whether in the community or in an outbreak situation. This particular epi curve is created to show the confirmed cases of COVID-19 in our region. On your vertical axis, you have number of confirmed cases, and on the horizontal axis, you have the dates these cases were confirmed. We created this particular epi curve to see how these cases are now shifting from the community to the long-term care homes, and the huge spike in the number of cases that we are seeing in these homes. The graph with the blue shades is showing the cases in the community, and the graph with the light green color is showing the cases in the long-term care home. And as you can easily see, the shift between cases from the community, which is blue, going down, and cases in the long-term care homes in the green is going up. So the next logical question comes to our mind is, are we seeing something that is really bad? Should we be worried? How are others doing? We looked at the regional and provincial rates, and we standardized it with per 100,000 population. We usually use the statistics to compare the number of cases based on the population size. Please note that this comparison does not account for variation in the number of people in different age groups. For example, roughly 18% of our community members are seniors, that is aged 65 and older. This is in comparison with the province with 16% senior population. If we do the comparison from that perspective, we are significantly high compared to the provincial average, but we are also in the cases in Lambton, Sarnia and Lambton is also high, which roughly makes, and seniors in that community roughly makes 21 to 22% of the population. So there is some age factor that is playing in when we are looking at these regional and provincial rates. The next question that comes to my mind is, how about the testing? How many people are being tested every day? And among those who are tested, how many of them are coming back positive? This is an indicator to show how prevalent the disease is in our community. And if more people are getting tested and not a lot of them are coming back positive, that means we have a problem. But if you look at the number of tests that are coming back, it's dropping all the way from 20% to 5%. The easiest way to explain that is we are testing more people that do not have the disease. And we have done that testing with many of our seniors and long-term care home population to get a better handle of what's happening in that facilities. We often use our data to give us age and gender distribution. The purpose of creating this graph is to show if there's any gender difference in getting infected. And as Theresa mentioned, we are shifting more towards females, roughly making up 60% of the cases and 40% of the male. And this graph further breaks it down to the number of based on their age. And we can see that clearly as we are moving up, we have 80 plus seniors with more females in that particular group. But the rest of the data is pretty much consistent in what we are seeing, what we saw in the past. So one of the questions that is frequently asked from us is the number of cases in each of the municipalities, and we were initially reluctant to share that information. But at this stage, since our case count has gone past 400 cases, we can say that it is everywhere, and everyone should be taking the same precaution. It doesn't mean if their community is safer or if their community is more dangerous. Having said that, this is what it looks like based on the municipality and based on the region. And once again, there is no community that is doing better or worse. Every community is equally impacted. Looking closely, there is no surprise. More than half of the cases are in Windsor, as more than half of the population live in the city of Windsor in our region, and each of the municipalities is as shown as in the graph. I would remind you once again, everyone should be taking precaution irrespective of where they live and keep themselves safe and protected. It is important. It is everywhere. We have cases in each of the municipalities. Other thing that we looked at is the exposure history. And when we presented our data last time, 34% of our cases were travel related. This week it has gone down to 22%. Understandably, because of stricter restriction on people crossing border, people going out. So the travel is very much restricted, and we are seeing a decline in the travel related cases. And most of these cases are happening now with either a contact of a case or a community acquired where we don't have any known cause of how these people contracted the disease. There are still 24% of the cases that are currently under investigation, and once we get the data, we will put them in our reports as well. Looking further into the COVID-19 by healthcare worker status, 3% of the cases in our communities is from healthcare worker. Around 5% of these cases visited a healthcare facility before getting infected. This highlights the importance of following infection prevention and control guidelines in the hospital and importance of healthcare workers sticking to one of the facility and not working in multiple facilities. If they are getting infected, they're not spreading to other facilities or to other people. So please make sure that you are using all the infection prevention and control guidelines to limit the spread of the disease in the community. So what is happening with our cases? Do they have any chronic illnesses? We looked at our data to answer this question, and this is what we found. Roughly 20% of our cases had some kind of a chronic medical condition. A small proportion of individuals were immune compromised, and similar number had either or have both chronic medical condition as well as immunocompromised condition. Majority of the cases did not, which is like 30% of the cases, did not have any chronic medical conditions. That is why the recommendation is for everyone, young and old, healthy or not, everyone is at risk and everyone is developing disease. Please follow the public health recommendations to keep yourself safe. Looking at further breakdown the risk factors, the most dominant risk factor is cardiovascular disease, followed by asthma, obesity, and diabetes. This is not surprising. The local health population health assessment data for 2019 that's available on our website has already identified a significantly high number of people who are overweight and obese, and cardiovascular disease as the leading cause of death in our community due to chronic conditions. My message to all Windsor-Essex residents, as we are focused on the COVID-19 right now, we will also need to watch out on some of our other health behaviors and pay attention to improving our health. Obesity, smoking, cardiovascular diseases are a big concern in our community, and we need to work on it to make sure that we are staying healthy and living a better life. Looking further into the cases and what symptoms they are presenting with. Fever was the most dominant symptom that all these cases presented with. Roughly around 4 out of 5 cases are presented with fever. Followed by cough. Every 3 out of 4 cases are presenting themselves with the symptom of cough, followed by fatigue, malaise, and the rest of the symptoms. Please note that a case can report more than one symptoms. So what we are trying to show here is only one symptom that is more prominent, but a case can have a fever, also have cough, can also have fatigue or malaise. So any of these combination is possible, but what we're trying to show is what's the most dominant symptoms that these people are presenting with. So where are we with all these cases? And we can say that roughly half of these cases are self-isolating in the community right now. More than 10% of the cases are resolved or recovered. And unfortunately, we lost 4% of our cases in our community, and all these individuals are seniors older than 70 years. Less than 10% of the cases are in the hospital or ICU, and we are still investigating over a quarter of these cases. Many of these cases are in a long-term care home right now. Looking further at the breakdown of deaths in our community, because that's another question that people asked us, and we look at it, and we can say that majority of them had some kind of chronic medical conditions, more than 50% of them, including either just a chronic medical conditions or chronic medical condition and also in an immunocompromised condition. We can still see that we have at least 1/3 of these cases where we do not have information on them, and we are in the process of collecting information from them. So now the biggest question is, where are we heading? Last time when I showed this graph, we were in the upward trajectory with respect to the case doubling rates. Our cases were doubling at a rate of slightly higher than 2. But now we are doubling at a rate of more than 3 days, a slight improvement again. But I would caution everyone not to read too much into it, because we still need to see a continuing trend for a long period of time before we can comment on these numbers more confidently. As of now, I still anticipate that we will continue to see a steady increase in daily case counts, and that is why it is very important to keep doing what we are doing with respect to physical distancing, following public health measures, washing our hands, limiting our unnecessary activities, our unnecessary trips outside of our home, and most importantly, staying home when you're sick. Even few people not following these measures can trigger a big increase in our community, which would put us back to where we were before. So I please urge all of you to pay attention, follow all those public health measures and guidance, and be safe, keep our community safe. Thank you.
We'll now take questions from the media. We'll start with Blackburn.
Okay, I guess I'm seeing kind of the doubling rate go down. There's less cases in the community. The governor of Michigan is hinting that they're going to reduce social distancing measures by May 1st. Are you concerned that people may start to not take these measures seriously?
Of course, there is this concern, and we should be taking every step very cautiously. As I said, most of these cases or these impact of our actions show up weeks later. Anything that we are doing right now, the result will show up later. So it would be good to see that what we are doing right now, but we need to continue to do it. As soon as as long as we have cases in our community, the likelihood of spreading it in our community is there. And we have to put all those measures in place to then limit the spread of those cases out in the community at a broader level. Having those looser restrictions or opening up borders or opening up businesses, it can put us back to where we were before. So we have to approach this very cautiously until we are in a position to say that, yep, our cases are none in our community and we are not seeing anyone, or at a level where we can say that, yes, it is manageable. People are still following all those measures, including the physical distancing piece, including staying home when they're sick, and also reporting to and getting tested and getting treated and cared for in the right manner. I think there are a number of steps that need to happen before we get to the stage of start talking about how do we get back to normal. The world has changed in the last 2 months, and it will continue to change. We have to be patient. We have to look at it in a way that we have put our time for more than months now in putting all these measures in place to ensure that our community is safe. We are doing our part in flattening the curve, which we are starting to see some evidence of flattening. But it can all go back to where it was before if all these measures are gone.
So, I mean, your thoughts on the splitting measures in 2 weeks? I think we're a lot further away than that. I mean, Michigan has so many more cases than we have. So, can you comment on that at all?
Well, obviously, we are in the proximity right across with our a big city, which has seen a significant number of cases in the community, and any looser restriction. And if we are getting exposed, then it would be much more challenging for us to deal with that too. I'm sure all levels of government are thinking about it before it actually happens. From a local perspective, I would support keeping some of these measures in place for a longer period of time and get rid of some of these cases in our community. And I think that's the best thing that we can do. I would again say that all these efforts that all the results that we are seeing is an effort for months and months. We do not want to undo all these efforts, and we should be approaching it very, very carefully. And even if it has to happen, I'm sure the various levels of government will take a graduated approach rather than just going all out open. But that needs to be discussed, that needs to be approached maybe locally, provincially, and then federally.
Any questions from CTV?
Yeah, just your thoughts on patients being moved from the LTCs to the Sportsplex. Is that already happening, or is that something that's going to happen later on today?
The conversation is ongoing, and we were working with our partners to come up with an approach. What would be the best way? Because obviously, when you're making some of these decisions, none of these decisions are risk-free. There is a risk to move these patients. There is a risk to keep these patients at the same space. So there has to be a number of consideration that needs to happen before some of these moves happen. The good thing is we do have a facility that is up and running and ready to receive these patients. The hospital occupancy is right now based on anticipating the surge. There are some beds available in the hospital too. And everywhere we are trying to come up with creative ways to address this increase in these long-term care home and retirement home. There has been push from the ministry as well to see, when you have all these beds, what can be done to move some of these high-risk patient population and put them in a safer way. The recommendations also includes having a temporary pause to move patients from the hospital back to the long-term care home or retirement home. So all these measures we are trying to do to keep that vulnerable population safe. I can't say that we have a decision already when this move is happening. It should happen soon. The conversation is going, and those details will come out as we finalize all of those details.
If it happens, well, David Mouger went on the radio today and said it's pretty much going to happen, right? So is this something that's being discussed only here in Windsor? Like, are we the trailblazers in that respect, I guess?
In some cases, I would say yes, because it is something that is not open up anywhere else. There has been some conversation, but I think we would be the first one that is actually moving forward at a rapid pace compared to others. The conversation has been going on in some other communities as well, but we do have at least we have an approach. We haven't finalized all of those details because there are still some details that we need to finalize. Who are these people? How are they moving? Are they all sick people? Are they all well people? Which homes are we using to transfer? How is these transfers are happening at the graduate level? The facility, are they only accepting people who are COVID positive or people who are just COVID negative? So some of these details, I think we still need to finalize, but what I can say is yes, they do have the capacity. And even like the other details of transfers and what happened with staffing, I think those details are obviously are finalized, and we are in conversation, and we should see some movement pretty soon.
So could this happen with the homes that are in bigger outbreaks than others? With the 7, let's say, for starters.
Yes and no, because again, we're trying to take a cautious approach in identifying. So some of the homes, if they are the consideration that we are suggesting, that it depends on how big the facility is, depends on how many cases are there, depends on how many staff are affected, depending on the facility's ability to cohort these people. And when we're using the word cohort, meaning if they are sick, can they safely keep them away from people who are not sick? And their ability to do it, either based on their physical layout of the facility or based on their ability of the staff to serve them. So there are a number of considerations, but obviously the focus is on where these cases are right now. But it could change to say, let's say if there's a new home and they just have one person, and maybe the thought would be, okay, why not we just remove that person and then leave the facility to deal with the rest? So all of those options are being considered right now, and that's why when we are saying that we have come up with an approach and we provided that approach, and hopefully based on our conversation, we would like to see some actions happen sooner than later.
Any questions from the Windsor Star?
The 3 most recent deaths, were those individuals, the 2 of them who were residents of long-term care?
All 3 of them were resident of long-term care home or retirement homes.
All 3 of them, okay. So I'm just looking at the numbers. The 13 total were residents of long-term care, but I thought yesterday I counted about 11.
I'm looking at my EPI, and we can get back to you on that, but the total count is 13 at this point.
Okay, but all 3 of the most recent ones were long-term care?
A long-term care home or retirement home, yes.
Okay. And otherwise, I'll sort of asked all of my questions so far, so that's it for now.
Okay.
Sorry. Any questions from CBC?
Yes, good morning. First, I just wanted to, as a regional hospital put out a release that St. Clair College will be opening up to people living in long-term home care facilities with COVID-19, and that's going to start Saturday with the first people being from Heron Cares. So can you confirm that?
I cannot confirm that at this stage.
Okay, well, that is a press release that the hospital has to do. You want to move on to my next question?
Yes.
Today's 568 pending test results, focus right now is on first responders and people in long-term care facilities. Do you know how many people from the general public are getting tested at this point?
The testing rate in general public is pretty much steady. Now we have 2 assessment centers in our community, and what we know from the data that the hospitals are putting up, roughly 70 to 80 people are tested at Windsor Regional Hospital. I'm anticipating the same number of tests happening at the Erie Shores Healthcare as well. We did a lot of testing proactively at the facilities yesterday. working with the EMS. So I roughly I would say between 100 and 150 tests are happening for the community residents, and the rest are happening with the long-term care home residents in our region.
Has the criteria changed? I know at the start it was just they traveled from places that had cases of COVID. What are the criteria now for general public to get a test?
So Theresa mentioned all those criteria in her presentation, but mainly the key criteria still is you have to have symptoms. You know, if I am a healthy person, if I want to get tested, I probably won't get tested. Most of these testing are happening if you are symptomatic, and more specifically, if you're a healthcare worker, if you're a first responder, if you are a resident in the long-term care home, if you're an inpatient person, if you are someone who is in the ICU, all those people will definitely be tested. And but after having an assessment done either at the assessment center or by your primary care provider or based on public health recommendation.
Has there been any thought to reaching out and testing the homeless population, people who maybe wouldn't go to the hospital themselves if they felt it?
No, absolutely. Those conversations are going on right now, and we will see some proactive testing in that population. Theresa is working directly with our community partners to make it all happen, and we hope to see getting more testing done in that population within the next few days.
Okay, thank you.
Any questions from Windsor?
I know we're seeing a lot of cases in local long-term care homes recently. But what does the situation look like in terms of community spread, say, over the last week or so? Are we seeing a slowdown?
If you look at our slide, one of and I'll try to go back to that slide. It does. If you look at our slide, hold on for a second. Okay, we're good. Okay, let's try to go back to. Hold on for a second. So this is what the slide shows in terms of the cases in the long-term care home, retirement home versus the community cases. The bar with blue, it is showing community cases. The bar in green, it is showing long-term care home or retirement home cases. And as you can see, there's a downward trend in the blue bar graph, and there's an upward trend in the green. And that is what it's showing in the community, that community it's slowing down a little bit, but it is picking up in the long-term care home and retirement homes.
And in those settings where there is still being trends there, is it happening in grocery stores or is it happening in a certain specific setting?
It would be very difficult to pinpoint where exactly these things are happening. We do ask if they are a contact of a case, and we can still see that there are a number of people who are confirmed contact of cases, and so that's how we know that they are directly in contact with the confirmed case. But a significant number still is community acquired, where we cannot pinpoint where they picked up the case.
Any questions from AMA 100?
Yes, I just wanted to expand, if you could, on the results being available online now. You can check what information do you need and where they go. Because I'm doing a lot of these results will probably be elderly people or people who don't have access to the website. So who can check these results?
So the link to the website would be available on our homepage, and if people are going there, they can click on it to get access to that portal. The portal uses a combination of your health card number, your name, and your date of birth to provide you with that detail. And if for any reason you do not have access to a computer, or if you do not have the ability to test these cases, you can still contact us, and we can do that that check for you, and we can give you the results. But in the interest, if you have the ability, I would request that please go online and check it out yourself. If it's not there, that means the result is not updated as of yet. It would definitely save our staff time to do exactly the same thing that you already done. But just be mindful of the request. But anyone who do not have access or anyone who is unable to do it, please contact us, and we'll try to do our best to check for you and provide you with results.
Okay, thank you.
Any further questions from Blackburn?
I guess just to follow up on the last question. So the health unit not following up on positive cases individually now, it's up to them to check the website to see if they are positive?
We are following, and we will follow up all the positive cases in the community. That is part of the case and contact management, and not only just the cases, anyone who they have come in contact with. This is just to expedite a process that if someone is looking, more specifically the negative. And if you are concerned about a negative test, and if you're not hearing from us, you can go online and check out yourself to see if your result has already been reported. With the increased number of testing that is happening right now, it is becoming more difficult to make that physical and personal contact with someone to share the report of a negative test. Positives are a priority. The moment we get the positive result, we immediately reach out to the individual to notify them about their results, and we also collect all that information that we need from identifying the contacts, so that the contacts are notified and are asked to self-isolate as per public health management document. And that's why I'm saying, as the number of cases are increasing, the workload in public health is also increasing as well. Everyone who is getting tested, that is in excess of more than like 1,600 people who have gone to testing. Our staff are working extra time to make sure that we are following up with almost all of them to get some basic data on them. And when you have cases, you can imagine if you have like 400 cases, our team of nurses are calling each of these individuals, and so that means like at least 400 or 450 calls, plus calls to all the contacts, which could range anywhere between 3 to 10, and all of those contacts are then identified, notified, had that connection, so you can imagine the work that happens on the back end. You are getting just the confirmed case number, but there's a ton of work that is happening on the back end with respect to data collection, with respect to notification, and we are trying to stay on top of everything, and that's why reporting and making that connection with positive is very important, and it's happening in a timely manner. With the negative, there could be a delay just because of the priority of reporting back.
Any further questions from CTV? Windsor Star?
And how many staff does the health unit have making these phone calls every day?
I don't. Okay. More than 80 people who are involved in all of these case and contact management, including returning phone calls from people, and you can imagine almost all of our staff has now been redirected and redeployed to respond for COVID-19. There are only limited staff that are doing, again, some of the work that is critical. Like, for example, we're still following up with many of the TB cases in our community, any other type of infectious diseases that are happening in the community. So we are still doing all of that work on top of what work that's happening with COVID-19. So I do not want to undermine their work, because that work is also important, because if we don't do that, then we may end up in having more than one outbreak. So where our staff are doing everything, and all the management team, we have shifted all our resources to ensure that we are doing to our best to contain COVID-19 and also keep the community safe from all the other infectious diseases threats and other health protection issues.
So not having to reach out to people who tested negative for that notification frees up time to do a lot of work that would have had to be done anyway.
Well, those work has to be done anyways, and I think that's why there was some time when there has been a delay in reaching out to those people. But as the case counts are increasing, and the work is also multiplying quite significantly, it would not free up time, but maybe it would be more focused on the most important work that needs to happen.
You've still got public health nurses nurses going out to long-term care homes and facilities for the tests as well?
Yes, we do. So we do have a public health inspector. We do have the nurses, and we are working with some of our community partners as well to not only go to these long-term care homes and retirement homes, but we are also going into some of the shelters, some of the other migrant farms. There's a lot of work happening at the other side as well, and our staff are, depending on their level of expertise and their role in the organization, everyone is busy. Everyone is doing more than what they have done in a normal day.
Thank you.
Any further questions from CDC?
No, thank you.
That's right.
Thanks.
AM 800? Okay, thank you, everyone.
Thank you.
Clear? Just one second.